Welcome to Unmask, and today, me, Seema Naik, I have a very special topic for those who are planning family. Prenatal and postnatal, a topic which our guest, Kresha Halani, is going to cover. Welcome, Kresha. It's great to have you.
Thank you so much for having you.
Yeah, yes. Actually, I have been looking forward for this for a very long time. You have specially gone to Rishikesh to cover this and much more in yoga.
Absolutely.
So yoga, of course, हम सब follow तो करते बहुत कुछ. How many of us strictly do it? That all depends on how consistent and how serious you are. तो Kresha, कुछ guidance इस पे, especially जो भी सोच रहे conceive करना या already pregnant है या after pregnancy, you know what they can still do.
So yoga आपको सारी ही चीज़ों में हेल्प करता है. अगर कोई प्लान कर रहा है बेबी तो हस्बैंड एंड वाइफ बोथ कैन डू सम क्लेंजिंग प्रोसेसेस बिफोर कंसीविंग. आसन प्रैक्टिस कर सकते हो जिससे फर्टिलिटी चांसेस इंक्रीज हो जाते हैं. So all those things, and someone who's already pregnant in any trimester and after postpartum also, you are always welcome to do the yoga.
But before we go into all the details, थोड़ा अपने बारे में पहले बताओ ताकि ऑडियंस को पता चले कि person who is originally from Mumbai, going all the way there, of course, to Rishikesh, and she got so attracted to the place.
Absolutely. So my background is in graphic designing.
Okay.
My education background is in graphic designing, but post that I realized I can't sit and do the job for like 9 to 12 just sitting in front of a laptop screen and working all day. So I knew I was made for something else. Yoga I was always practicing it, but then I went to Rishikesh, I practiced over there, I learned different things over there, and that's how it stuck with me. And yeah.
So that was your calling. You
Yeah,
realized
that
your
was
calling.
my calling. So now I teach yoga as well as I'm a pranic healer, and as well as simultaneously do a little bit designing also as a freelancer. All together, yes.
But I think now the kind of work you're into, it is a combination of spirituality and medical science.
Absolutely, absolutely.
Yes.
That is the
So-
main focus as of now.
So how is it when a couple comes to you? How do you deal with them? Where do you begin when it comes to from the conceiving stage? What are they supposed to be aware of and what are they supposed to follow?
So they are supposed to take care of everything, because we think that okay, having a baby is just like, you randomly go, you conceive and then you have a child. It's not like that. You can do proper planning 6 or 3 months before, ahead of conceiving. You can, there are various ways in yoga where they talks about cleaning the body, or in Ayurveda there's a different way of cleaning the body. You do that, you balance your body first. Yoga talks about different ways to clean the body. Simultaneously there are asanas, there are breathing exercise, there's pranayama which allow your body to become more healthier. So all those things can be practiced before conceiving, and after conceiving also there is a set of asana, pranayama practices that both of can do, especially the mother has to practice, so that way they can go for a more safer pregnancy and more healthier pregnancy.
Absolutely. So there's a lot of stress of being positive during your pregnancy. Do you do anything specific for this?
Let's just say not about pregnancy only, but let's just see how in day-to-day life also your thoughts affect you. Okay? Let's try an experiment, so you will have a better understanding why people also tell you it's very important for the pregnant woman to be positive, or stay in a happy state of mind. You can say that.
Definitely.
Yeah.
I would love to try out what you want to
Show me. You just stand
Yeah,
up.
sure. So Kresha, what are we going to do now?
We'll do a simple experiment, or we'll just see how your thoughts affect you and your energy overall. Okay. Take your arm forward, make a fist with one hand. Okay, perfect. Now I'll check your strength. Okay. Push my arm up as high as you can. Use your maximum strength over there. That's it?
Yeah.
Come on, go higher. Yes.
Oh, why?
Okay, I can see your muscles being engaged, so that is your maximum over there, okay?
Yeah.
Okay, perfect. Now this is your normal strength.
Okay.
Now I want you to think something negative, okay? You can think about yourself, you can think about just for an fun way, but think negative about someone else also, or just think something negative.
Let me see.
Yeah.
Somebody that would maybe, really give trouble. Yeah, I thought of that
Let's them
myself.
later on, but yeah, you can just think a little negative about something
Yes.
that I'm of no use, or I'm feeling low. This does not work for me. This is not happening anything for me.
Yes.
Universe never works in my favor. Something negative 3 to 4 times in your mind.
You already told me enough.
Okay, that was the next one. So you thought something negative?
Yes, I did. Yes.
Okay. Now I will check your strength again. Okay. Where did it go? No, seriously, it was just now. It was still here.
Yeah.
I mean, come on. I just said it with मजाक में यार. कहाँ गई strength?
Yeah, I can see the effect.
Effect?
Yes.
You see how your thought is affecting you?
I'm not able to move my hand up.
Come on, you're cheating नहीं करनी है. Come on. Press me harder. No?
No.
Okay, release.
Yes.
Now, whatever statement you had said it earlier, the negative one, change it into a positive one.
Okay.
And repeat it 3 to 4 times to yourself, or if you're saying it to someone else,
Yeah, I'm
just go
awesome.
positive.
I'm great.
Perfect. See it more.
Okay.
Think about positive one. You're the strongest woman I know.
Oh, lovely. That is helping.
That is,
Yeah.
said 2-3 things positive about
Yes,
yourself.
yes.
Okay, now again crazy one. Want to check your strength. Bhai, kaha? You
That's how it
see,
is going up.
that's how it's going.
Yes.
I'm putting equally the same pressure, and this time your arm is going up.
Yes.
What does
Higher
this?
than in fact before.
Yes. So what does this state as?
Hmm.
Your thoughts affect your energy.
Hmm.
So imagine now.
Yeah. Please,
Yeah,
yes.
sir.
This was fun.
Yeah, this is one. So, in conclusion, what I mean to say is, you see how your thoughts affect you, and your energy as well, your aura as well. Now, imagine being pregnant, and you're not affecting only yourself, but you're also affecting the child. So, hence, it is important for the pregnant lady to be in a more positive state, or be at least take care of your mental health. That is why it becomes so much of more concern these days. But all of these women also work in agencies, corporate every day.
Yeah.
A lot of stress, completely takes over them. So it's very important for them to take some time out for themselves, and where they feel safe, a place where they feel more connected with the baby, and the happy hormones should be released as well when you're practicing. So yoga is such a way where you practice and then the hormones get released, you feel better, you feel calm, more relaxed. So hence prenatal yoga is a good way to do so.
So I think this is a beautiful example. I mean, we had a lot of fun doing it, but in just seconds, the variations in thought, the kind of impact it had on the body. That was really nice. To
Yeah.
see.
So in general, not only pregnant ladies, but everyone should take care of their
Everybody,
mental
yes.
health. What's your thoughts? What do you think? What do you say? That becomes very important in day-to-day life.
Yes, absolutely. So this is from the positive, thought process.
Yes,
What
absolutely.
else is very important, because yoga at this time would be very different from what is normally practiced.
Prenatal yoga is a very safe and gentle practice tailored specifically for pregnancy, and it includes different breathing techniques, relaxation poses, few asanas which help you to strengthen and increase the flexibility, and most importantly, it prepares the body for labor, not just physically but mentally more.
Yeah, I was about to ask you that.
Yeah.
That it is entirely about that. The postnatal would be, is that coming in prenatal or postnatal?
Postnatal is after pregnancy. Once the delivery is done, the postpartum we call it later on.
Later.
And prenatal is when you're pregnant over 9 months, you practice it that time. We call it
So
prenatal.
all the 9 months there will be different asanas to perform.
Yeah, usually prenatal yoga can be started from throughout the pregnancy also, but we recommend people who are joining in new, they can start with the second term, that is your second trimester, that is your 4th month, because first 3 months are a little bit more slightly high risk, so better to take care at that time, and then later on from 4th month you can work on yourself.
Okay. So there is an entire program.
Yeah, program. So trimester wise modifications changes, poses changes, the goal or the aim of every month is a little different than the previous one. At the same time, a lot of other things also matter, your diet, your day-to-day activities that you do.
Yes.
So all of that also needs to be taken care of. The prenatal yoga provides you a platform where it takes care of everything.
I get it. So Kresha, during this phase, what are some of the concerns Why I'm asking if there is a medical complication. So in that situation, does it differ like what you do?
Yeah, in some cases you are not supposed to practice asanas. So when I say yoga, yoga just does not mean asana poses.
Most
Okay?
people,
Think of it that way. So there are breathing techniques, there are meditations, there are other activities which you can do in general also. So that are things you can do in cases of placenta previa or placenta abruption or any other condition where the doctor has completely said no, that you're not supposed to do it. So please take rest. I will not encourage people to do so. If you have the green signal from your health provider, please you can practice asanas and yoga. It's everything.
Okay, and what about the pelvic area? Because this is area given a lot of focus at this time.
Yeah, good that you brought it up. I
Yes.
wanted to mention, so pelvic floor muscles are a hammock of muscles from your pubic bone to the backbone connected, and that holds up your uterus, your bladder and intestines. So during the pregnancy, because of the baby weight and everything, the pelvic floor muscle stretches a lot, and as a result they can easily become weak. So strengthening of pelvic floor muscles become a very important part of the pregnancy. And even postpartum, it will be better if the recovery goes very quickly, if the pelvic floor muscles are strong. So in pregnancy, you can practice Kegels, there are other bridge poses and everything, specifically targeted to increase the pelvic strength. So those exercises should be done regularly so that the pregnancy also goes in a smooth way, and after pregnancy also you have less complications.
That's true. I think your sessions are mainly online, right?
Online and offline, we have both. People connecting from different cities can join online. People can base in Mumbai as of now, so people connecting in Mumbai can join offline.
So
as well.
Mumbaikars, you know where to go. One thing, a very common complaint we hear, I don't have time, a lot of them are career oriented, and even if you are a homemaker and you have a very, very busy schedule, so ये बहुत सुनने मिलता है कि करना है, but I just get to sleep. वो एक बहुत है कि सबका ये टाइम पे मूड अलग होता है. The body
हाँ,
different.
absolutely.
हाँ.
Every pregnant lady's body is different, and the one person who feels something is comfortable, the other lady may not feel that comfortable.
Yeah.
So you need to make a set of practice for yourself where you feel comfortable, you feel good, you feel safe with that practice.
Right.
It should not be like मुझे नहीं करना है या मजा नहीं आ रहा है and I'm doing it. No. And related for the time, as you said, for the working women and everyone, at least I feel on weekends they can take some time out. Or during the day, I'm not asking you to like take 2-3 hours a day, or no, not like that.
So it's not a daily.
You can. If you practice it daily, it's very good.
Okay.
But for people who are working and they don't have time, try to do it 3 times a week or on weekends, as and when it fits in your schedule. Or at least I still believe if you're pregnant, at least you should take half an hour out for yourself every day.
Yeah, little care for yourself.
Self-care is important. You can take it as that aspect and the time where you are connecting just with your baby.
Yes.
So
So those who
that
are
is
very, very
important.
busy schedule, you can manage at least once in a week is good. Is that good, or do you suggest minimum 3?
Twice or thrice a week should be bare minimum you should practice it. Again, then depending upon your comfort zone and everything.
Yes.
But yeah.
And do you encourage both the couples involved? So they both should be there for the
Absolutely,
process.
because as much as the woman plays the role, taking care of everything, husband gives the emotional support that a woman requires during pregnancy. So your husband and the family support plays a very important role. In fact, there are asanas, there are some poses where husband can also be involved. They can practice them together. All of that also can be included.
So as you know, Kresha, we always talk about like sleeping issues. जैसे the belly grows bigger, it becomes more and more difficult to sleep properly. I know this. I have also gone through it. So
So you must know. Nice. So this is a very बोलते हैं ना, बहुत कॉमनली प्रेग्नेंट लेडीज को ये प्रॉब्लम होती है कि स्पेशली लास्ट स्टेज ऑफ प्रेगनेंसी की कंफर्टेबल स्लीपिंग पोजीशन नहीं मिल रही है, या कैसे सोना है, लेफ्ट सोना है, राइट सोना है, सीधा सोना है, बिकॉज पेट की वजह से बेली बड़ा हो जाता है तो डिस्कम्फर्ट फील होता है कहीं ना कहीं पर. वुमेन कैन स्लीप टूवर्ड्स द लेफ्ट, पिलो बीच में रख सकते हो नीज एंड थाइस के वहाँ पर, टर्निंग टूवर्ड्स द लेफ्ट दे कैन स्लीप। बैक पे सोना थोड़ा सा रिस्की कहा जाता है, यू कैन स्लीप फॉर सम टाइम बट नॉट लॉन्गर देन अ मिनट। देयर इज अ वेन कॉल्ड एज वेनाकावा, तो वो पैर से लेके अपने हार्ट तक होती है, तो वो पूरे बॉडी से ब्लड लेके आती है हार्ट की तरफ। नाउ इफ यू आर स्लीपिंग ऑन द बैक, तो बेबी के वेट के वजह से दैट नर्व दैट वेसल मे गेट कंप्रेस्ड, सो ब्लड सर्कुलेशन वहाँ पर रुकने के चांसेस होते हैं, तो इसलिए इट्स नॉट सेफ टू स्लीप ऑन द बैक फॉर अ लॉन्गर पीरियड ऑफ टाइम। You can sleep towards right, left, more preferably towards the left. It's a safer option, and I think it should be manageable.
Yeah. तो अभी भी ऐसे बहुत सारे लोग हैं जो कोई प्रोग्राम नहीं फॉलो कर रहे, जस्ट यू नो प्रेग्नेंट होने के बाद रेगुलर रूटीन नहीं है, जो बिफोर प्रेगनेंसी का। तो इसका एक्चुअल बेनिफिट नाउ दैट ये सारे हमारे पास प्रोग्राम्स है, ये बहुत पहले से इनफैक्ट एंशिएंट डेज में फॉलो किया जाता था।
एंशिएंट डेज में योगा पर्टिकुलरली नहीं था, क्योंकि वुमेन वर वर्किंग सो मच, घर पे ही इतने काम हो जाते थे कि पूरे दिन भर का वर्कआउट उधर ही हो जाता था।
फिजिकल
वर्कआउट उधर ही हो जाता था, तो अलग से ये करने की जरूरत नहीं पड़ती थी। आज लोग ऑफिस में जाते हैं, आप सुबह 9 से लेकर शाम को 6-7 बजे तक एक ही जगह पे बैठ रहे हो, काम कर रहे हो, उसकी वजह से बैक पेन होता है, पेल्विक पेन हो जाता है कई बार। तुम्हारी बॉडी में ब्लड सर्कुलेशन ज़्यादा होना चाहिए, रेगुलरली इम्प्रूव होना चाहिए और प्रेगनेंसी के रिलेटेड, तो तभी जब आप आसन और ये सारी चीज़ें प्रैक्टिस करते हो तो उससे स्ट्रेंथ बढ़ती है, स्टेमिना बढ़ती है, फ्लेक्सिबिलिटी इंक्रीज होती है, तो ये सारी चीज़ों पे आप ध्यान दे सकते हो। एंड वन अनदर इंटरेस्टिंग थिंग अबाउट दिस इज, आई वाज रिसेंटली reading it somewhere, there's a study done in Thailand, where there were I think 74 ladies, they had randomly picked them out and they had divided them equally in 2 groups, okay, all of them pregnant. One of the group, they were given classes once or twice a week, and the rest of them, they were just following their day-to-day activities throughout the pregnancy. So what was noticed at the end was the women who were practicing regularly, like even just once or twice a week, they were following the classes, they were following everything, those people had a shorter labor and more manageable labor. Compared to
less complications.
Yes, less complications, less medical intervention, and everything was there. So benefits तो दिख ही रहे हैं. It's just that you need to make some time out for yourself and for your child.
See, that's the thing, that अभी the kind of environment we are in, isn't it? It is
absolutely. पूरे दिन बैठे होते हो, ब्रीदिंग पे हमारा इतना फोकस नहीं होता है, बिकॉज अनदर थिंग चेंजेस इज विथ योर थॉट्स, योर ब्रीदिंग चेंजेस। ओके, एवरी इमोशन दैट यू फील, अगर आप खुश हो तो आपका ब्रीदिंग पैटर्न अलग है, आप दुखी हो, आप इफ यू आर क्राइंग द ब्रीदिंग पैटर्न इज डिफरेंट, इफ यू आर एंशियस, इफ यू आर स्ट्रेस्ड आउट द ब्रीदिंग पैटर्न चेंजेस अगेन। तो फॉलोइंग और ट्राइंग टू मेंटेन अ गुड ब्रीदिंग पैटर्न, ट्राइंग टू इम्प्रूव योर ब्रीदिंग पैटर्न आल्सो, वो सारी चीज़ आपको ब्रीदिंग टेक्निक्स में भी सिखाई जाती है कि हाउ टू रिलैक्स योरसेल्फ एंड एवरीथिंग। स्पेशली लेबर के टाइम क्या होता है ना, वुमेन बिकम मतलब पैनिक हो रहे हो, टेंस हो रहे हो, फियर हो रहा है, तो बाय डिफॉल्ट सबकॉन्शियसली बॉडी मसल्स को टेंस कर देती है, तभी ब्रीदिंग पैटर्न वापस बदल जाती है। तो पहले से वो चीज़ प्रैक्टिस करना बहुत जरूरी है कि आपको रिलैक्स कैसे रहना है वो स्टेज पे, या
स्पेशली न्यू मॉम्स तो
फर्स्ट टाइम के लिए वो ज़्यादा डिफिकल्ट हो जाता है, तो तभी ब्रीदिंग पे कैसे फोकस करना है, बॉडी को कैसे रिलैक्स करना है, सो दोज थिंग्स मैटर अ लॉट।
I wish I had knew, you know, ये प्रोग्राम मैंने किया होता। I did panic.
Because some people have labor for 1-2 घंटे का भी होता है, किसी के लिए 12-13 घंटे या उससे भी लॉन्ग हो जाता है, so it depends upon a little depends upon your body, complications and everything, but still prenatal yoga gives you a higher chances of more comfortable labor.
Yes, that is needed, and I look at it like you were mentioning earlier कि diet अच्छा हो, ये सब ठीक है, but it is a entire state of mind.
Mind also, absolutely.
I want to understand, like अभी हमारे पास टाइम कम है, so trying to conclude that, so yoga सिर्फ आसना नहीं है, so many other things are involved in it. तो जो अगर वो नहीं कर पा रहे, और क्या-क्या चीज़ें are included?
अगर कोई आसन नहीं कर पा रहा है फॉर एनी कॉम्प्लिकेशंस, दे कैन इंक्लूड ब्रीदिंग एक्सरसाइज कर सकते हो आप जो सेफ होती है, यू कैन प्रैक्टिस मेडिटेशंस, गाइडेड मेडिटेशंस होते हैं, यू विजुअलाइज प्रॉपर्ली सारी चीज़ें, तो दैट आल्सो हेल्प्स इन प्रॉपर्ली। Apart from that, अगर आप थोड़ा spiritual भी हो, आपको चीज़ें पढ़नी पसंद है, everything, you can also do mantra chantings.
Yes.
There are other ways. You can read some books also. Mantra chantings can be a good option because what are mantras? Mantras are cosmic sounds, a higher state of frequency. Okay, when you're pregnant and when you start chanting those, so somewhere you are raising your frequency as well. So that is a very good way to be more positive.
So, what about postpartum? The things that need to be followed at that time.
Okay. So for postpartum, if it's a vaginal normal delivery, pregnancy के मतलब 4-5 weeks के बाद you can start with the gentle stretches and everything, because again getting back to that routine is also very important. To strengthen the body later on, it's a very important part. You should not skip that.
Yeah,
And-
especially after having a kid, the lack of sleep. If the kid sleeps well, then fine. There's a lot of changes.
Changes in that. And if you're going through a cesarean, I would say take a first green signal from your healthcare provider. But apart from that, after 3 months, you can start with again the gentle exercises and everything. And then as and when the body starts to becoming a little bit more strong, you can move forward with the other asanas and everything.
Okay.
But one thing that you can do from day one after the after giving birth is you can again go for your breathing exercises.
Okay.
So
Yes.
that is very important for the hormonal changes going in the body. So it will help you cope up with that also. So that's one great practice you can always follow in your routine.
I am sure this is a very extensive topic. There must be much more you have to
Absolutely,
say.
I'm just cutting it short, leaving it short
I
for
get
the
it.
audience
You're
as well.
summarizing that for
Yeah.
you. So it's great. We'll have many more such sessions with her, and in various other areas. Whatever you can give us insight for yoga.
Absolutely.
And anybody who wants to get in touch with her, you have the details in the descriptions. Thank you so much for
Thank you
coming.
so much for having me here. It has been a great one.
Same here, same here. Thank you, and we'll be coming back with much more very soon.